Hi guys, Kat Grosshaupt here with Fit Life Austin. Today I wanted to talk to you a little bit about doulas. That's D-O-U-L-A. Some of you out there may know what a doula is, but I wanted to kind of clarify some misconceptions and then also talk about why you should consider hiring a doula. So first of all, I want to clarify the difference between a midwife and a doula. Sometimes people get the two confused or think they're the same thing. So a midwife is your primary care provider. You would go to a midwife instead of an OBGYN, and they do all of your prenatal testing. You go to all of your prenatal appointments are with them. Some midwives do home births, some do birthing center births, and then here in Austin we do have one practice that has midwives who are part of the OBGYN team and attend births in the hospital. And that is with Dr. Sebastian and her team up at OBGYN North. So that's what a midwife is. Now, doula is professional labor companion or labor support. And so what a doula does is provide you with support during your labor. We usually meet with couples a few times beforehand to get to know them. It's usually at the couple's home, and we go in and just get to know them, their desires for their birth, their preferences, more about just get to know them, what they're looking for in a birth, what role they see the doula playing in the birth. Just get a real good idea for what they're looking for. The couple hires the doula. The doula works for the couple, not for the hospital, not for anyone else. And so it's a nice way to have a third party, an objective point of view for various things. Mostly, so I'm a doula, and I've attended about 28 births. I'm actually waiting on my client right now who's in labor to let me know when she needs me to come assist her. But I would say 99% of my births have been in the hospital. That's also a myth that doulas are only used for out-of-hospital births. And really, I think that doulas are more useful. I don't know, I shouldn't say more useful. There might be more of a need for a doula's support in the hospital. And that's not to say that hospitals are bad or, anything like that. But, the truth is that the nursing staff and your doctor, they're great. They're usually very supportive, but they do have a heavy caseload. And nurses have said to me before, I wish I could be with every patient, all the way through their labor. But, they have other things to take care of. They have other people to attend to. They're just not around, the whole time. And so it's nice to have someone in there with the couple who understands the birthing process, the procedures and policies of the hospital, all that good stuff. Also, on that note, I consider myself, and I'm sure most doulas do, as part of the birthing team. And so it's not an us versus them kind of situation. It's not an adversarial thing. People often ask me, how do doctors and the nursing staff respond to you as a doula? And I usually say, well, it's all in how you approach it, but I make it known to the nursing staff that, they're the nursing professionals. I'm here to work with them as a team. It's a team effort between the parents, me, the nursing staff, and the doctor. We're all in this together for the healthy outcome of a healthy baby and a healthy mom, for sure. So, let's see. So I provide, and doulas provide emotional and physical support in labor. So basically, once you're in labor, you call your doula, let them know you're in labor, you check in with them, and then you talk, back and forth every little while until they decide that they need you. I've gone to people's homes before to provide labor support, and then we all head to the hospital, or sometimes I just meet them at the hospital. And then doulas will stay with you throughout your labor, of course, and then usually about an hour to an hour and a half after the baby comes to help you get, breastfeeding going well, making sure you're all taken care of as far as food, and just really making sure you're good and settled in. And then I usually make a home visit to my clients within the first few days after they get home from the hospital. Once their milk comes in, once they, have been home for a few days and have had a chance to settle in a little bit. And then we process through the birth together. We talk about any breastfeeding issues that they may have, and just, provide any kind of support or resources that they need. So, the thing about it is there's a doula for every woman. One of my doula coworkers, colleagues told me that once, and it's really true. You have to find a doula that works for you and that you feel comfortable with. Because birth, remember, it's all about your state of mind. It's all about you being comfortable emotionally is the biggest thing. So it's best for you and your partner to interview the doula together. And you want to interview several, even if you think you found the right one. On the first try, interview 2 more just to make sure. And then on that same note, prices vary. Prices vary from city to city. When I started out trying to get my doula training done, I did, the first 5 or 6 births for free. So there are plenty of training doulas out there that are great. They just need to get a certain number of births before they get certified. And then the price kind of goes up from there, anywhere from $300 all the way up to $1,000. And that's just in Austin, Texas. I'm sure in other cities it's a lot more and a lot less. I've never heard anyone say that having a doula was a big waste of money. Everyone afterwards is always like, wow, that was great. I'm so glad we had that support. So, another thing that comes up sometimes is from the partner, the birth partner, whether it's, some dads are afraid that doulas will come in to, and kind of take over and that they won't be a part of the experience. Or sometimes they want it just to be the 2 of them and they don't want anyone else in the room. And that's totally understandable. That's another reason why we have our prenatal meetings together, to find out what kind of environment you want, what kind of atmosphere, what role you see the doula playing. I would say a majority of the work I do in labor is with the dad. And again, he and I are a team. We are a team working together to make sure that the mom is comfortable. We really put a big burden on dads and partners for the big day, the big labor day. We expect them to take care of the mom and all of her needs, remember everything from birthing class, advocate for themselves and for the baby and the mom, get rest, be hydrated. I mean, everything, and it's a lot. It's a lot to remember and to take on. And so I look at my role as more of a peripheral one, making sure that everybody's taken care of, making sure that the dad feels comfortable, whether it's, going to get him food, or sending him out to get food so that he can have a little break, but never leaving the mom alone so that she always has someone there with her. And then also telling him, here, push here on her back. This will probably feel good. Or, hey, why don't you try this? Or why don't you try that? So that he feels empowered as well to, provide her with as much support as he can, and to assure him, that the baby's looking good. This is a very normal phase of labor at this point. It's okay that the mom's doing this or not doing this, or, it's a lot of assurance. And a lot of dads afterwards just are so appreciative of having a doula there, and of the help that I have given them. They just, they're able to not have to worry about anything except being with their wife or partner. And that's really nice to be able to do that. The other thing that some people say is, oh, my mom's going to be my doula, or my best friend is going to be my doula. And I always say that's great. It's great to have emotional support there, of someone that you trust and someone that you care about and that cares about you. The thing about that is that, that this is not their profession generally. They don't know the stages of labor. They don't know what's normal and what's not normal. They don't know the physiology of birth and, where the best places are to help relieve hip pain or back pain or different positions to try. They don't know how to read the monitors. It's just not their profession. This is a profession. It's not just holding the mom's hand and telling him it's going to be okay. And I've attended plenty of births where the mom was there, or the mother-in-law or whoever, and the dad and the birthing mother and me, that's totally fine. But, yeah, a lot of times your mom, sister, whoever, best friend, it's just not their profession. So that's something to think about as well. Yeah, so I hope that answered some questions about what a doula is and why you would want one. If you have any other questions or you need resources in and around Austin especially, please email me at fitlifeaustin@gmail.com, and I'll see you next time. Have a great day.